Welcome to the Eastman Dental Podcast, where we hope to inspire, motivate and provide education from our guests' experience.
So we're joined today by Nick Jackson, who's a registrar in Restorative Dentistry, and Amy Patrick, who's a registrar in oral surgery.
I think you have to be able to show commitment. You have to be committed towards it. Certain things, you have to make sure it's right time in your life as well. And you're able to, it's not a sacrifice, but you have to come, like you said, come in early. You have to work extra hours on occasions. And so you've got to have, you've got to be understanding yourself, also understanding family and friends, and they know that you're going to have a very busy job, but it's extremely rewarding.
Find out what it is that you do enjoy. Spend your time working out that you love it, because when you love it, you love coming to work. So ultimately, I do love my job, and that probably is why you see me here all the time.
With your host, Josh Hudson.
In one of our previous episodes, we talked to trainees that were training to be specialists. And in this episode, we're focusing a little bit more on trainees that are on the training pathway to ultimately be consultants. So to start off with, Amy, if you could just tell us briefly about yourself and how you got to the point that you're at now.
Yeah, hi. Well, thank you for having me today.
Okay.
My name's Amy, and I have just completed my specialty training in oral surgery. So I'm now at the point where I'm applying for consultant posts. So I've got a bit of a different kind of entry to where I am now. So I'm a little older than the average registrar, shall we say. Obviously, you don't look it, but you know. I've done a couple of degrees before I started dentistry. So I did my BSc in anatomy and neuroscience, and then I did my master's in pain, and then I did dentistry.
Okay.
And then even after that, I've done quite a few varied SHO jobs. So I've worked in pretty much any department that you can work in within dentistry, and kind of honed my skills and what I enjoy down until eventually I applied for specialty training. So it's been a long journey, but it's been a very fruitful one.
Okay, let's break that down a little bit more then. So
Okay.
what's the story going from those previous degrees and then deciding to do dentistry? What made you make that decision?
It was actually offered to me at the
Okay.
time. So I think I'd done a lot of head and neck things in my first 2 degrees. And so I was approached and said, would you be interested in becoming a dentist? And I thought, yeah, go on then.
Fair enough.
So I applied that way, did it, and then kind of carried on through that pathway. I think that's kind of been how my whole world has been. Just
Okay.
to take the opportunities as they come.
That's interesting. And Nick, what's your story?
Yeah, so my name's Nick. I'm a Specialty Registrar in Restorative Dentistry, and actually it's slightly different also, similar to Amy, is that I'm a member of the UK Armed Forces in the Royal Airforce. So graduated in 2010 and then joined straight up, and after military training did a number of sort of posts in the UK and overseas as well, including Falklands and Afghanistan and Cyprus. And then a few years later, I decided to apply for a master's program in periodontology here at the Eastman Dental Hospital. A year of that, and then working at Aldershot Dental Centre, which is kind of the specialist centre where you referrals get sent to. And then the position of Specialty Registrar came up. And that's where obviously then had to apply for that. There was 2 different selection processes, and we obviously talk about that in a second if you wish.
Okay. Yeah, that's really interesting.
That's really interesting.
So, So talking about the military aspect. So was it dentistry first, then military, or military, then dentistry? How did
it was dentistry first? I think it was like 5 years old. And my dad said, it's good to be a dentist. That's when dentists earn lots of money. No, I'm kidding. No, so it was really quite young, actually. I decided I wanted to do dentistry. And then actually I found an interest in the military when I was in secondary school. So I was a member of the cadet force. And that's where my interest stemmed from. And then I did a bit of investigation and then realized you could be a dentist in the military as well. And that's how it stemmed from.
So did they sponsor you through uni?
They did, yeah. So very lucky, yeah. So actually from first year, so at the time they offered a bursary, so it's a small sort of financial incentive, and then in my third, fourth, and fifth year, essentially I signed up officially, and then obviously with a normal salary, which is very handy, especially at university.
Yeah.
But obviously that came with the commitment as well. So at the time it was a 7-year commitment after finishing my degree, and then a few years ago, about 3-4 years ago, I signed another contract. So I'm signed up to about 2030 with the military at the moment.
God, so you definitely know what you're doing for the next few years. What about dental foundation training? How does that work with the military component? Is that through them as well, or is that just
it is, yeah. So when I went through, it was a bit bigger. As it currently stands for DFTs, I think the Royal Navy and the Army still have foundation dentists, and you go through a program. So you join the military, you go then get assigned to a local area, and then you actually become part of the NHS foundation training schemes.
Okay.
But also then you have your military aspect after. So you do your military training after completion of DFT.
Okay, interesting. Yeah. So, Amy, you said you did a lot of different things as an SHO. So I guess that you're definitely sure that oral surgery is the thing that you want to do. What made you come to that decision that oral surgery was the thing that you wanted to pursue?
When I started my first SHO job, I was doing a kind of general duties. So I got to work within peds, ortho, max fax, oral surgery. I did surgical dermatology, restorative, kind of did a bit of everything. And as I was going through that year, I quite soon worked out what I looked forward to and what I didn't enjoy the most. Mm-hmm. And I was very fortunate, or very pushy, whichever one it was, that over that year I got to kind of hone in what I wanted to do and gradually cut out the clinics for the things that I wasn't so interested in and focus more on what I really enjoyed, which was pediatrics and surgery. Mm-hmm. And then when I got to the end of that year, I decided I would like to do a full-time year in each of them to decide which I liked the best. Mm-hmm. So my following year was a full-time year in pediatrics. Mm-hmm. And then after that, I did a full-time year in max fax.
Okay.
And through that, I worked out what I really like is pediatric oral surgery. So I was sort of none the wiser in a sense. But the more I kind of worked through, I realized that I really enjoy trauma. And I'm just very good at it when it comes to children. So I think it was quite clear that my route had become more on the surgical side, but I preferred it with a younger patient. So since then, I've definitely made the right decision, because the more things I do now, and if they ask for things to do with a more restorative side, I'm a bit like, oh no, I don't like that anymore. So I'm definitely surgical.
Okay. And Nick, you said you did your Perio Masters. Was that kind of what led you into doing restorative, or how did it
was, yeah. So I had an interest in periodontology, and I think that's where it stemmed from. And then having worked here at the Eastman, and within the sort of the secondary care environment, and then actually going back to the military and working in, say, in that specialist centre, I was treating predominantly periodontology patients, but also I was actually treating other cases, so toothwear cases, implant cases, endodontic, complex endodontic cases as well. And actually, I started to enjoy all those aspects. And then this position came up, and I thought, well, actually, if I'm enjoying everything, why not go ahead and apply for it? And then that's where I am now.
Okay. And then, so building on that, it's probably a little bit different for yourself, but what was the application process? Was it different because you're in the military? How did that work in terms of actually applying once you decided that's what you wanted to do?
It was actually, yes. So it's actually a double selection process. So what everyone would go through the NHS, you go through the military as well. So that involved a standard application process. And when I think about 13 people applied for that, and then it went down to a four-person board. So that involved interview process and a half a day of clinical skills. So you're preparing a cavity preparation, or undertaking an endodontic treatment on an endo view block, and an OSCE station as well. So that was the military aspect. Then the final 2 candidates got selected from that, and then were then submitted to the NHS selection, which I believe at the time was in Manchester. Gloucester. And they're very similar. So it's over 2 days. The first day is with the clinical skills hands-on tests. And I believe it was a crown preparation at the time, veneer preparation and suturing skills as well. And then the second day is the interview process, which involves, I think at the time, 4 OSCE stations involved from talking about yourself, your CV, going through patient management, clinical management, and also looking at a station on evidence base as well.
So a double interview process. Then,
double interview process, I know. Within a very short period of time as well. Well, it's good practice for the NHS one, I suppose, the first one.
True. So did you get any preference as because you come from the military? Did you just need to benchmark, or did you need to?
Exactly. Yeah.
Need to benchmark?
So I needed the benchmark, and then once I had benchmarked, and then I then was given the opportunity to essentially ask or approach a dental hospital to see whether they would have an extra space for me, and then the military did that on my behalf, and then when that was confirmed, then I got my NTN number, and then went from there.
Okay. And just to clarify, if anyone doesn't understand, just benchmarking essentially just means that you need to pass the interview, right? You don't need to necessarily be the best in that selection process. You just need to reach a standard.
It's a pass mark, essentially, isn't it? Yeah.
Okay.
Yeah.
And Amy, how was your selection process to get into your training?
So I didn't get to benchmark. I just had to be the best.
You're better than me.
So for oral surgery, it's national recruitment now. So for that one, you have your standard application where you put all the things that you've done. It is quite, I'd say standardized is quite a strong term now, because it is a lot of drop down answers. You don't necessarily get any free text anymore. Yeah. So you can't really flourish and show how varied you are. And then if you get an interview, you go to a 2-day interview. And one of them, it's kind of similar. Yours sounds very surgical heavy, actually, or procedure heavy for Nick's interview. But you do have to do a surgical station, and then a lot of the other stations are things like writing out consent forms, or dealing with a complaints letter, or doing a critical appraisal, which we all enjoy. So after doing all of those stations, you've also, the second day is usually the main interview station. Or you have portfolio management, communication with actors, things like that. So it's a pretty heavy going 2 days, because it's, you're there the whole time, you're there overnight. But then, of course, everybody gets ranked, you choose your places and get offered the jobs out from that way. I think things are changing a little bit, and because it's quite new for oral surgery, I think they are refining the process. So now you don't have a full portfolio station. Instead, you have 2 parts of your portfolio, which is normally a peer-reviewed paper that you've written and an audit. And you have to take both of those in, and they will choose which one they want to discuss with you. Okay,
interesting. I think from people I've spoken to, oral surgery seems to be very competitive. I'm sure everything's very competitive. How competitive are we talking to get into oral surgery?
It's extremely competitive. So not only do they get hundreds and hundreds of applications, but there are only usually around probably 6, 7, 8 places in the UK per year. Then, and because within oral surgery, historically, you kind of go into that role already being able to do surgery. So your bread and butter is already taking out surgical wisdom teeth, because you've usually worked as a staff grade for a few years first. So the difference is that all those people can already do the surgery. So every single person there is very capable, which is why they focus a lot on the management and the leadership side, because that's the bit where you need to kind of like put them to the post. So it is extremely competitive. But it's getting the jobs at the end. So you can't just up the numbers and even it out, because where would everybody go?
Exactly. And it's the same in restorative, Nick, as well, in terms of it being competitive.
It is.
So as you know, I applied for restorative last year, and there were 4 jobs and 86 applicants, just to give an idea for people as to how competitive that element is as well. So yeah,
I think it was around about
well to get to where you are now.
At the same my year as well, when I applied, about 100, just shy of 100 applied. So it is very competitive.
And we were talking about this in one of the previous episodes with some of the other specialty trainees, about the different aspects that are a bit confusing potentially about specialist training. And there's this element of post-CCST training, or whether you're just training to be a specialist or whether you're training to be a consultant. I think that confuses a few people. So Nick, with restorative, it's just a run-through program. You go start to finish and then you're eligible to be a consultant at the end. Is that right?
That's essentially correct, yeah. So you do 5 years of specialty training, and at the end you have your examinations, which currently is in 2 parts, Part A and Part B. And then when you've essentially passed those, you've then gained the qualification, and then you apply to the GDC to become onto the Specialist Registrar in Restorative Dentistry. And then that's when you subsequently you apply for your consultant positions as well. But that will be a separate application process to actually be a consultant. So you can work as a specialist in restorative dentistry outside, but obviously to be a consultant, you obviously have to undertake a further interview processes.
Have a consultant job, okay. And then how does it work in oral surgery? Is that the same, or do you have this post-CCST component, or how does the oral surgery pathway work?
So the normal oral surgery pathway is a 3-year training program. There are some post-CCST posts available. They're advertised completely separately, and on the whole, it's not the kind of usual pathway that most trainees take, but you can choose to do those things if you want those extra competencies. Now, we do quite a lot of extra within our own training anyway, so we don't tend to find we need them. And again, as I was saying before, when you come into training, you're normally already quite good at surgery. So that's probably why it's also a bit of a slightly shorter course, because you're learning more about the management side, as well as honing in your skills to make them really refined and do the really complex cases. You are eligible to become a consultant after those 3 years. But the same with what Nick was saying, you can become a specialist, you can work that way if you choose. So it kind of depends on what job you want to go for and where you'd like to work as to what happens at the end of the 3 years.
Okay. So, but you are eligible to apply for consultant posts?
You absolutely are, yep.
Okay, that's interesting. And then Nick, you touched on this a second ago, in terms of once you actually get into the role. So you've got through that application process, well, you've decided that's what you want to do. You've got through that application process, you've started. I think the difference, or the thing that people need to consider maybe between maybe a monospecialty, if we're thinking about restorative and restorative training, is you don't necessarily get that taught element. So I understand that if you do perio, endo, pros privately, you're affiliated with a university, it's more taught to you. How does it work in restorative? Do you get taught things, or is it more of an apprenticeship where you just learn on the job, or how does it work in terms of actually acquiring that knowledge?
Yeah, so it is different. It's more clinical rather than academic, but not saying there is no academic element to it. So, for example, we have weekly didactic sessions, which is registrar-led, but consultant overseen by consultant. And that ranges from topics from, as I say, ranging from oncology, periodontology, implantology, other aspects of restorative dentistry as well. And we also have a Pan-London session. So every month we go meet with the other registrars in our London area, where again we have further teaching sessions. You also have time within the working week for study. So actually it's self-directed study where you have to go sort of learn aspects of restorative dentistry. And also the consultants do encourage you to go on certain conferences and obviously develop your academic skills via that way. You can also link up with some the academic institute as well. So there are ways of sort of joining certain courses which are run by the institute to develop your academic skills as well.
Okay. And Amy, is that similar? Is there any teaching component to, or formal teaching component to your training, or is it more, like Nick was saying, kind of having allocated time to go away and do that yourself, I guess?
So we certainly have STR training days. So across London for our deanery, we get together once every couple of months for a planned teaching day at the different hospitals. So that particular hospital will organise what the training is going to be on, and then you go along, learn, listen to what you need to do. If they do some hands-on, that's always a benefit. And then the next hospital does it as well. And so it could be on anything. And the idea is you try and cover the curriculum across your 3 years. But of course, because you've got a turnover of trainees throughout those 3 years, some things are going to get covered a couple of times, some things you might miss. So of course, there is also a big aspect to self-directed learning.
And as Amy was saying also about the hands-on element of the course, restorative dentistry also is very hands-on. So you obviously get the element of treating patients, but also we're working within the clinical skills environment as well on different aspects of dentistry.
Okay. And then I guess the next question that people will be interested in is what is that workload like? How do you find going away, doing that self-directed study on top of all the clinical things? Nick, I work with you. I see that you registrars are always very busy. How
I'm
do
not
you...
going to deny that it's very, very busy, and it is difficult. I'm not going to deny that, but you really have to make the time. So when you get that time, you have to sort of shut yourself away and just revise or look at whatever you're doing. I probably would say sometimes other things get in the way. So you get short notice tasked by the consultants to do things within the hospital or organise other things, and therefore you may have to make time elsewhere in the evening, potentially sometimes on occasions, but also I would say it's important to take rest time as well, particularly at the weekend. So you have to find that balance and what works for you.
How's oral surgery? Is oral surgery as intense?
Crazy all the time. Never stop running. The one thing that you probably know, being that you both know me so well already, is that everybody knows who I am because I literally run around every single floor.
I think it's like five Amy's in the hospital. 4 currently.
So it's a very, very busy job. Surgery is extremely hands-on, very personable. So you have to be in the room. You can't learn surgery without surgery. It's as simple as that. So it's very, very busy. So just like Nick was saying, you have to find your other time, and you have to do things in the evenings or weekends. Certainly when it comes up to revising for exams and things, that's extremely busy. And the curriculum, it turns out, is even bigger than you even realize yourself. So there's a lot of learning behind things. You learn a lot on the job, because when you have a patient that has, X, Y, and Z that you need to learn how to treat, you need to do it before you actually operate on them. So that does help at the same time. Okay.
And you touched on exams there. So what do you actually have to do to complete that training? What is the pathway? What are the exams? What do you need to do to finish, essentially?
So of course, over the 3 years, you have your regular assessment, or over 5 years, I'm guessing for Nick, you. So you have your regular assessments throughout the years. So, when your consultants are watching you operate or do a clinic or whatever it may be. And for oral surgery, at the moment, there's one exam you take at the end of your 3 years, which is your Emerald Surge. And for that, it's a 3-day examination.
Sounds lovely.
It is very
intense.
full on. It's incredibly intense. Yeah. So you have written exams, you have unseen cases where they question you for half an hour on each case, pretty much for a whole day. I remember being in that room for just over 5 hours.
Oh God.
And they also have a communication exam where you discuss different things with patients and show that you're not a complete monster, that you can talk to real people as well. And at the end of that would give you your qualification, and all you have to do is complete your training and be signed off. There is going to be a small change in the future for oral surgery trainees, because the training is potentially moving up to a 4-year course, and rather than doing the Emerald Surge at the end, you'll do the ISFE, which is the usual post-CCST exam.
Yep.
That's not set in stone at the moment, but it is certainly the direction that they're planning to head to.
Okay. So now you've passed those exams, you've got that piece of paper, you just take that to the GDC and say, sign me up on the oral surgery specialist list, and they do it. Is that how it works? Yeah.
And I'm officially on a register.
Well done. Congratulations. Do you feel any different?
I feel a little poorer.
Fair enough. Nick, how does the assessment process work for those 5 years of restorative?
I mean, it is similar to Amy, actually, in a way. So obviously you're getting regular assessed on clinics by the consultants on your clinical cases. Every year you have your annual appraisal, ISEP, and that obviously comprises of you have to do certain work-based assessments and submit a portfolio based on that. Once you pass that, you're then able to progress onto the next year. The ISFE examination has changed slightly in restorative dentistry. So now there is two parts, Part A and Part B. Part A is the critical appraisal paper, and essentially you can apply for that whenever during your 5-year course. And I believe that it's a 3-hour examination, looking at 3 critical appraisal papers, 2 based on your restorative dentistry, and then 1 on another aspect of dentistry. And Part B is normally taken towards beginning of your 5th year, and that comprises of a management examination and also a clinical examination as well.
Okay. And also with restorative, I know historically you got all 3 monospecialties as you were specialists in all 3 monospecialties as well as restorative. I think there's some change around that. Well, it has changed. I think there might be some more change. Can you explain a little bit about how that works now, whether you're eligible to be on those lists as well?
So I don't know the exact answer. From my understanding currently is that you are not eligible to be on the 3 registers. You'll be a specialist in restorative dentistry, but you may be able to apply to be on the registers of periodontology, prosthodontics and endodontology. But you would have to show equivalence for that.
Okay.
So I say wait out regards to that.
Okay, that's great. So from what we've talked about, from both of these roles, this sounds quite intense. It sounds quite hard work. So my next question is, why should anybody listening decide to pursue these pathways? Why not work in practice and have an interest in restorative or oral surgery, or be a specialty doctor in hospital in one of those areas? Why would you suggest that somebody would pursue actual specialist training in these areas?
Well, I think that within surgery, you can do small surgery, which is what you'd be able to do in practice, or you could do big surgery. So more exciting. So big surgeries, of course, need to have bigger safety precautions, better skills, more complex cases, medically compromised patients, all those things. They all belong in the hospital. So if you go through your training, you're much more likely to get the bigger, juicier, sexier surgeries.
Fair enough.
It's exactly the same, actually. Very similar. It's not necessarily surgery, but actually it's kind of surgeries if you look about implants. But because you're working in a second care environment, you're liaising with all different types of specialities. You might not be able to do that in a small practice outside. I also would say that if you want to drive change or actually lead, actually is a really, really good position. In a practice, you might not have as much opportunity, but in hospital certainly there are a lot more opportunities to do that.
And then following on from that, what advice would you give to somebody who's considering either pursuing oral surgery or restorative?
We both pause because we're both thinking, I'm not sure I would recommend it all the time.
I do sometimes on days go, why am I doing this?
What am I doing? No, I probably would say, if it's what you enjoy, definitely do it, but find out what it is that you enjoy. Spend your time, working out that you love it, because when you love it, you love coming to work. So ultimately, I do love my job, and that probably is why you see me here all the time. So if you want to work a 9 to 5, being a registrar is not for you. You have to be able to think, well, not that I have to come in early and I have to stay late, but you have to kind of think, I'll go in early for this because that would make, that would be better for the patient, better for me. And, I've ended up staying late because that's quite normal. And I wouldn't encourage doing that all the time. Nick was saying earlier that you've got to make sure that, you get your work-life balance. But ultimately, I feel like a registrar personality comes alongside going that extra mile as part of your norm. And so if that's not the pace that you like to work at, then I would say not to go for it. But for those who want to, I would say put absolutely everything you have into it, because the more you put in, the more you get out. And that sounds really like one of my old teachers or like a parent or something. But sadly, I've obviously come to that age where I say the same thing to other people.
Fair enough. So figure out what you're getting into, make sure that that's what you want to get into, and then put the most into it to get the most out of it, I guess.
I would agree. I think you have to be able to show commitment. You have to be committed towards it. Certain things, you have to make sure it's right time in your life as well. And you're able to, it's not a sacrifice, but you have to come, like you said, come in early. You have to work extra hours on occasions. And so you've got to have, you've got to be understanding yourself, also understanding family and friends, and they know that you're going to have a very busy job, but it's extremely rewarding. Yeah.
Okay.
But you have managed to have a baby.
Yeah, you have.
Yeah,
so,
yeah.
You know.
So your probably next question is, what would you consider doing differently? Not having a baby. No, I'm kidding. Sorry, Isabel.
Take it back.
Okay, that's great. So we're asking everybody the same final couple of questions, and we might have touched on this a little bit already, to be honest. But if you could describe 3 things that you enjoy about your job, so through all that hard work, all of that stress, can you give a couple of things that stand out that you enjoy about your job?
I really enjoy interacting with the other registrars and my cohorts, and learning from them, because they're all very experienced, and yeah, I've really enjoyed getting to know them. So that's number 1. Do you want more?
Yeah.
Number 2,
There's more?
There's more. No, that's it. Yeah. And number 2 is the complexity of cases. I would not be seeing what I'm seeing now in general practice, and it's so interesting. And I'm not just working at Eastman. I'm doing other detachments at the hospitals, Charing Cross. Obviously, working in the military for a day as well. We've got potential other opportunities, maybe in Cambridge, to look into the future. So you work with you see different environments, but also working with different consultants, and you pick up loads of different skills from them. And even just shadowing them, you do learn lots. So that's number 2. I'll come back to you in the third one. Give me 2 seconds.
That's okay, because I'm going to storm right in here.
Okay, good.
For me, within oral surgery, of course, the number 1 thing that you like about the job is operating. Surgeons, we like to cut, we like to operate. Without that, that's, the majority of it gone. So, as Nick was saying, complexity of cases, doing, really interesting, big, complicated things where you really do need a surgical skill. It's not something you could ever do in practice. Lots of things are, but there are just those handful of cases that just put a massive smile on your face because you just enjoy operating so much. Secondly, in what you've already said, actually, it's the social side of things. It is so nice to be within a hospital where you get to meet everybody, you liaise with different people, you learn off different people, you get so many different opinions. And, ultimately, you all know the oral surgery gang pretty well here at the Eastman. And we are definitely a social bunch. We are all about the camaraderie and the bolshy personalities that go with it, as well as us being, very skilled surgeons, but we're also a family. So I think I absolutely love the fact that oral surgery certainly seems to come with a real family atmosphere. We look after each other, we look after everybody else, and we're very laid back and just kind of crack on and get on with it. And that's something that when it sits well with you, I think that works really well. It's one of my favorite things. And then I think overall, it's just the variation. I'd probably say that was my number 3. Variation in what you get to do. I get to go work with ENT, I get to go work in MaxVax, I get to do skins, I get to do, like an easy day for me would be just taking out some lovely surgical whizzies. It can be really basic, it can be really complicated, but you get to do so many different things. And after that, you get to go and do them in so many different places. So I think that's probably why I love oral surgery so much.
My number 3. I think it's actually making a real difference to patients as well. Actually,
I should have said that.
I was thinking, what's a good one? No, generally, because in practice, whilst it might be quicker, you don't see that level of difficulty. Actually, but in hospital, whilst it might take a bit longer to complete the treatment, you generally actually make a difference for some really difficult cases, and it's amazing to see at the end results as well.
That's great. And then my final question, which Nick's already alluded to, is now that you've got to this point in your journeys, if you were going to go back and speak to your younger self, what piece of advice would you give?
That's really easy for me. I would say, go on holiday, take a break, don't work at the weekends.
That's good advice.
Any of these things. I think, I've now come to the point where I think, I should use my holiday. Don't locum during your annual leave. So anybody listening, do not locum during your annual leave. Take your annual leave.
Solid advice.
It's good advice. It is good advice.
On one hand, I think if I hadn't done triple on calls and worked every weekend and started early, stayed late throughout my whole career, I probably wouldn't be the surgeon I am today or the person I am today. But I think it doesn't mean that I couldn't have been. So I think it's important. Work life, work to live, not the other way around.
Yeah, I think I really agree with that. I think for me, take a Saturday or Sunday off every weekend. Just one of the, and the other day you probably will have to work, but making sure that rather than just constantly working, because you be careful to burn out. So probably being aware of your level of tolerance of how much and when you need to rest, and also looking at starting a family recently. Maybe doing that a bit later or earlier, or starting registrar training a bit earlier. I'm not joking, but no. Just make sure you, as we mentioned, the commitment. You've got to be, I say, 100% committed and have a really understanding family as well.
All your things are going to be on the front door.
Yeah, exactly. I'm out.
That's great. Thank you both so much for joining us. Amy, I know that you're meant to be supervising clinic and you're here and also there at the same time. So thank you for that. It's been really great. And I hope our listeners have found that really useful.
Thank you.
Thanks for having us.
Thank you.
We hope you've enjoyed listening to this episode. We would love to hear your suggestions for future guests. Remember to follow us on social media using hashtag the Eastman Dental Podcast. And if you like what you hear, please like, share, subscribe and listen out for future episodes.